Welcome back, everyone. I'm here now with Dr. Sini and Dr. Hardin, and they're here for Diabetes Awareness Month. It's our third week, I think our fourth week and our final week, and we've learned so much, and you're sort of going to take us back on a recap of what we've talked about this month.
First of all, we're very grateful, Greenwood-LaFleur Hospital and myself, very grateful for the opportunity to make the Greenwood-LaFleur Hospital and its staff have the ability to educate the people on diabetes, and it's really an epidemic here in the Delta.
It is.
And we talked about previously the crux of the way we're going to fix this problem is through education. We talked about the Greenwood-LaFleur Hospital having a certified education center. We talked with Dr. Gurnis about our dedicated wound center. Last week I talked about podiatric or foot care.
Yeah.
Today I'd like to talk about the examinations that go into determining whether someone has diabetes. We know what the risk factors are: obesity, genetics, hypertension, sedentary lifestyle. We also know what some of the signs are: weight loss. We also have frequent urination, frequent thirst, and fatigue. And some of the tests that should be done to determine whether in fact you have diabetes, my colleague Dr. Hardin will now talk about.
So tell us how you determine if you have diabetes.
So the first step is just a comprehensive medical exam, which includes a good physical examination. There are three things that we typically look at. As Dr. Sini mentioned, increased thirst is something that's typically present, blurred vision, vision disturbances or changes, and then increase in thirst. So the first thing that we do is get a fasting blood sugar. So if there's a patient that's coming in for a routine examination, just for initial visit, we ask that they don't have anything to eat after midnight, which is very important. So we can do a finger stick blood check there in the office, and if that's elevated, then that sort of hones us in to move further in the screening process.
I've had that finger prick done. It's really painless, and you get the results in 5 minutes. Is that right?
Yeah.
And when you are testing people, you work with family care?
Yes.
Are you seeing, who do you see as a typical patient, and are you seeing diabetes in children as well?
As Dr. Sini mentioned, the Delta is really the epicenter of metabolic syndrome and diabetes mellitus here in the United States. So most of my patients have a family history that's significant for diabetes. So typically in this area, most patients will at least have that as a positive risk factor. That coupled with an additional hypertension being one, which there's a strong prevalence of hypertension here in this area, most patients need to be screened.
But are you seeing it who is, like, describe for me who the typical patient is, because if people are at home sort of, is this me, you know?
So the first thing you need to identify is if you have a genetic predisposition, family history. Second, if you have a diagnosis of hypertension, if you have hypercholesterolism, if you're overweight, have a sedentary lifestyle, as mentioned before, those will be things that would key you in that you need to see a primary care provider for an evaluation. So we couldn't really say there's a typical patient for diabetes because the prevalence is so high here. It's probably going to include everybody.
It is so high.
And in fact, 1 in 3 hospital admissions, the patients have diabetes. And the key is, and Dr. Hardin does a great job in screening and treating, but one of the key tests is the hemoglobin A1C test, which actually monitors the effectiveness of treatment. Would you like to discuss that?
Yeah.
So the hemoglobin A1C is just a big word for glycosylated or sugar-infused blood.
Sugar, okay.
So that gives us a 3-month look at what your blood sugar's like. Because if you know, a lot of times patients will kind of clean up their diet a day or two before they come in to see a physician. So then your blood sugar is seriously low.
It doesn't fool it though.
Yeah. So.
And is that when you get a number, like a 5 point something? Okay.
So 5.7 to 6.4 is about pre-diabetic. About 6.5 is a diagnosis of diabetes.
And I guess we've talked about education so much, and so I'm going to ask a question that I hope is not obvious. But if you're diagnosed with type 2 diabetes, is that a diagnosis for life, or can you reverse the symptoms if you do lifestyle changes?
Well, lifestyle changes are early and effective, but you always have to watch because of the predisposing genetic factors. Okay, just like hypertension. I mean, there's a lot of genetics involved. But the whole point of our initiative in response to the community assessment needs is that we can help these people. This is not hard to do. What it does, it takes all of us. And Dr. Gurnis mentioned a couple of weeks back, we need to engage the family and friends as well. Diabetes is not a life sentence. It's something you can live with, but with the multidisciplinary team approach of all our specialists, and education, as Dr. Floud said, is key, we can work together to reduce the risk. And if we do that and we eliminate some of these risk factors, we can go a long way in preventing the harmful effects like blindness, kidney disease, and dialysis, and amputation. So we really, at the Greenwood-LaFleur family, want to thank you for the opportunity
Yeah,
to be able to go out and to help people in the community. We have our website, glh.org. Certainly you can call me at the office. I'll be very happy to help anybody. And all of us from the Greenwood LaFleur family, we would like to wish everyone in the viewing audience a very happy Thanksgiving.
Yes, happy Thanksgiving, but don't overindulge, right? In those
Everything in moderation.
Exactly, and well, we've learned so much this month, and thank you for coming on. And it's really important to go get tested, go to Greenwood LaFleur, or go to your primary care physician. Even if you don't have symptoms, you know, you might be pre-diabetic, right? And this is a time to nip it in the bud.
Baseline is always good to check.
Early diagnosis.
Awesome. Well, thank you guys so much for coming on. I've learned so much, and we have great coffee mugs that you brought us. I need to bring them on. I'll bring them on after.
Greg wants Red Bull mugs.
Yeah, it's the Red Bull mugs, and you guys have been great guests all month long. I've learned so much, and we'll be right back.